Good afternoon. Welcome to the DCRI Research Conference. Before I introduce today's speaker, I'd like to thank Anika and Antonella, who are in the back. They have come forward to help with coordinating the DCRI Research Conference with the departure of Liz Faust. So thank you so much for learning this in a hurry and doing a great job. It's great to have you. I'd like to also welcome the people that are joining us remotely, and as a reminder, we do archive all of the presentations, and typically they're posted within a week or two for your viewing pleasure. Today's speaker is Emily Mazure. This is a very, very important topic. I've already emphasized something that she knows well, and for those of you that don't know, please pay attention, because this is really important from the perspective of the National Institutes of Health. Emily is the Biomedical Research Liaison Librarian at the Medical Center Library and Archives. And her background is really interesting to me. She received a Bachelor of Science degree in biology from Central Michigan University, followed by a Master of Science Information from the School of Information at the University of Michigan. She then went on to perform a libraries fellowship at North Carolina State University, followed by an education and research librarian position at Virginia Commonwealth before she's come to Duke University Medical Center, and we're happy to have her with us. The topic today is NIH Public Access Policy Compliance. So Emily, thanks so much.
Thank you. I'm just going to start some handouts that people can pass along. There's a single sheet that's just a bunch of links and pointing to places, and then there's actually copies of the slides if anybody wants them. There's probably not enough copies of the slides for everyone, but hopefully the single sheet, and I'll show you where you can download the slides at the end. Before I get started, can I just see a raise of hands of how many people here are PIs or authors that need to do this for themselves? So we have a couple, great. And I'm assuming that everybody who didn't raise their hand is potentially going to be helping an author or PI do some of this work. Most of the time I'm going to talk as if I'm talking about an author or PI's role, but I'm going to throughout the entire presentation make sure I emphasize what someone who's not an author or PI but doing work for them, what their role would be and how they can do this work. Please don't hesitate to stop me and ask questions as I go along. There's a lot to cover, so hopefully there'll also be plenty of time at the end to ask questions. Okay, so this is kind of just a quick overview of what I'm going to talk about. I'm going to first just describe what the policy is, and I want to go over a couple of terms that I'll be using so that we're all on the same page and know what I'm talking about. And then we're going to talk about how to get an article submitted to make it compliant, and then how to use something called My Bibliography to be able to manage that compliance on your own without NIH or the library having to email you to tell you why stuff's out of compliance. So this is the details of the policy. Basically, any article that was a result of NIH funding and was published in a peer-reviewed journal, it was a peer-reviewed article, needs to be made publicly available in PubMed Central. And that has to be done within 12 months after the article is published. So those are the basic details. The types of articles that fall under the policy, it needs to have been peer-reviewed. So a lot of times we're seeing people get a little bit confused because they have written an editorial that's in a peer-reviewed journal, but that editorial wasn't peer-reviewed before it was published. So that doesn't actually fall under the policy. It wouldn't need to be made publicly available in PubMed Central. It's also, there's this April 7th of 2008 date, so if it was accepted prior to that date, accepted for publication, then it doesn't fall under the policy, doesn't need to be made publicly available. And I'm going to talk about how the NIH right now doesn't necessarily know these things, and they're just pulling a lot of articles that may actually be exempt for one of these three reasons. And I'll show you how you tell NIH why that article is exempt. I mean, of course, it has to be a direct result of NIH funding. The reason this is a big issue right now is because earlier this year, NIH sent out a new notice saying that for non-competing continuation grant awards with a start date of this July 1st, they will delay processing if you're out of compliance. The other piece of this is that they're now requiring everyone to use a tool called My NCBI, and a particular part of that called My Bibliography, to basically keep track of all of your publications from all of your grants, anything that basically you've produced, to be able to then create reports for the new eSNAP, the RPPR reports, and other things that you'll need to generate. There's actually 2 guides at this point that we've created. This first one is a very basic introductory guide of what the NIH public access policy is, but probably a little bit more useful at this point is this compliance specific guide that's really focused on what people need to do now to kind of go back in time and fix a lot of articles that have been sitting and need to be made publicly available. And I'll should have time at the end to open this up and show you where everything that I'm talking about now is available up online to go find. All right, so those definitions I mentioned. The first thing I want to clarify is the difference between PubMed and PubMed Central. So unfortunately, they sound very similar. There's just that one word, the central, that makes them different. But they're both databases. PubMed Central, I've already mentioned because that's where an article needs to be made publicly available. It is entirely full text. Everything in there is the entire article. And that is why that's where you need to put these articles. And every article in there has an ID number called a PubMed Central ID number, or PMC ID. And so later when you're trying to prove that you're in compliance, you need to have that ID number for that article. This gets confused a lot with PubMed, which is a well-known database, but what you're searching in PubMed is just the basic bibliographic information about millions of articles. And you're not actually getting full text in PubMed unless you're somehow linking into a journal's website or something. But within PubMed, you don't have full text there. And so that really doesn't have anything to do with something being publicly accessible and meeting the criteria for the policy. But everything in there does have an ID number as well, and there it's a PMID number or PubMed ID number. So a little, hopefully this will clarify, because most people are familiar with what a PubMed record looks like. So on this article, you'll see that you can scroll down and you'll see here the PubMed ID number. But if it's in PubMed Central, you'll also see a PMC, a PubMed Central ID number. So that's the way to tell if you're in PubMed if this article has been made compliant with the policy or not. Okay, the other distinction I want to make is between the final peer-reviewed manuscript and the final published article. So most people are familiar with the final published article. When you go to the journal's website and download the article, that's the final published article. The publisher and the journal itself owns the copyright to that. They've done copy editing to that and stylistic changes to make it that nice PDF. And the only entity that can actually put that into PubMed Central is the journal or the publisher themselves, because they own that. The final peer-reviewed manuscript is what the author still owns. So it's at the point that all the peer review edits, like everybody has to go through the publisher to get that article. They can only do it for up to 12 months on any of these articles that fall under the policy, but they have everything from 6 months to 8 to 12 months that they'll put an embargo on the article saying, you can't make that publicly available, only we can make that available. So it's something that you should know as an author, so you're not trying to upload something before it's legally allowable under the publisher. And then we're going to talk about the NCBI, which is the National Center for Biotechnology Information. And this is the system that they've created is called My NCBI, where you can basically keep track of your publications using a feature of that, which is called My Bibliography. So we'll be looking at that in detail later. Okay, so this is my attempt to kind of pull everything together and show this in a visual way. I like visual. So here you see we would have someone has NIH funding and publishes a peer-reviewed article. And so as long as it's after accepted for publication after that April 7th, 2008 date, it falls under the policy, needs to be added to PubMed Central. We'll look more specifically at how it gets in there in just a moment, but generally speaking, there are ways that it'll actually just directly be added by the publisher right into PubMed Central sometimes. Often, though, what happens is either the publisher or the author or PI of the article will submit the final peer-reviewed manuscript that the author owns the copyright for still into that manuscript submission system. So it'll go into that system, and once something is submitted there, it actually has to go through 2 different approval processes, and that's usually one of the authors is selected to do those approvals, and after it gets approved twice, it'll finally be put into PubMed Central. Everything that's in PubMed Central will actually be added to PubMed if it wasn't already in there, and then they link back and forth. We saw that on that image that I showed you. And PubMed, within there you can create your My NCBI account and then pull articles that are in PubMed to put them into your bibliography and create your list of publications. Now the big thing is you also need to have, once you've set up your My NCBI account, you have to correctly link that to ERA Commons. If those 2 accounts are correctly linked, you'll be able to see all of your grant information in your bibliography and be able to associate articles with particular grants. And then in ERA Commons, you'll be able to generate reports based on the publications that you have in your bibliography, because they'll all show, that's the only way to get your publications to show up in there at this point in time. I've highlighted the areas where we have the most problems right now. So a lot of authors and PIs didn't realize it was their responsibility to submit something to the manuscript submission system. So it's changing as people learn more about this, but primarily most of our articles fall under the case where they just need to be submitted. Nobody's submitted them, somebody needs to go find the files, upload them to the manuscript submission system. The other thing that we have a lot of are things that have been submitted maybe by the publisher or by a different author, and they're just sitting in the manuscript submission system and haven't been approved. So these 2 approvals, so they haven't made it into PubMed Central. There's a short window of time that you can have stuff sitting in the manuscript submission system and still be in compliance. And if you haven't gone through those 2 approvals and finally got into PubMed Central, it actually ends up being non-compliant again because it's not in PubMed Central yet. And I'll talk about that more near the end. And then finally, a lot of people just don't know about My NCBI and that they need to set up their bibliography and then link that account to ERA Commons. So we just have a lot of people that need to start working with that system and being able to manage all of this on their own. So I'm going to pause briefly. Does anybody have questions about the definitions I've gone over or the general process? Yes.
I have a basic question. You said that this is only going to NIH, but what about other health and human service agencies, government agencies like FDA or?
As of right now, so the question is does this apply to any other agencies other than NIH? And as of right now, it's just NIH, and I mean any like smaller entity under NIH would any grants that you would consider being from NIH. This is what it falls under. There are other entities like NSF has started talking about doing something like this as well, but as of right now, it's just NIH. Yeah.
What's been confusing is when you said directly funded by NIH. We have a number of situations where the research was funded by another entity, either industry or some other thing, but a fellow who might have NIH funding was on it.
Yes.
So it's not directly funded, it's having any relationship, any way look sideways that could potentially be government funded. Yeah.
So basically I would just, any way that you could associate with NIH funding, I would include it as falling under the policy and being a direct result. A lot of times what we've told people is if it's something anybody would put on a progress report or something like that, that would, if you were going to ever report it as being an article that was a result of that funding, you would want it to be taken care of.
Agency for Healthcare Research and Quality gets its funding as originally from NIH, right?
Yeah, but it's mostly if fellows, for example, are the biggest
fellows, yes. Teaching grants, yes. Which are messy. Any other questions? Okay. I've already talked about these, so just move on. So let's talk about those submission methods. So they've broken it up into 4 submission methods. A, B, C, or D is what they call them. If we think about the diagram I had, method A and B were that direct line into PubMed Central. Basically, the publisher takes the version that they own, the final published version, and directly deposits it into PubMed Central. The only difference between these two you'll see is that it says author arranges, which basically means the author is going to pay the publisher to do this. The author should confirm that this is done in the correct amount of time as quickly as it needs to be done. But this is generally, if you publish with one of these journals or one of these publishers, there's usually not too many glitches in the process because there's nothing else for you to do. We're going to focus more on method C and D. So you see here that it's basically the same except for C, that's the author or someone that they delegate that submits the final peer-reviewed manuscript, the version that they still own, to the manuscript submission system. And at D, the only difference is that sometimes your publisher will actually do that for you. They'll submit the final peer-reviewed version into the manuscript submission system. But basically, anytime something goes into the manuscript submission system, we have those 2 approvals that I mentioned. The very first one, so when you go and you upload documents, you could upload one single document, or if you have the text of the article and then several files of figures, you can upload each of those separately. However you end up uploading it, they take that and just merge it into one big PDF. And so then they ask the person who is designated to do the review and approvals to look at that PDF and then just make sure everything is there and make sure that it was associated with the correct grants and the correct article. And so once that person has gone in, looked at that and said, yes, this is okay, it'll be turned over to the manuscript submission system staff, and they take that PDF version and turn it into what's called a web version, which is basically what you'll see on PubMed Central, because everything on PubMed Central is on the web. Right now, that is taking around, I would say, about 4 weeks, give or take a little, probably. And so it's important that if you have articles, you start submitting right now so that they can get through that process prior to July 1st. But once the web version is created, again, that same person will be asked to review the web version, make sure there was no errors, and then approve it before it's actually added into PubMed Central. And you won't have a PubMed Central ID number until all of that is done. Any questions about that? Okay. We're going to focus on method C because that's where the author, or if they ask someone to do the work for them, their delegate, would actually submit the article to put it in, to eventually have it into PubMed Central. But they're not going to submit directly to PubMed Central, but to the manuscript submission system. And basically what you want to submit is everything you submitted for publication. So all the figures and supplemental material. And again, you can do it in one file or multiple files, however is most convenient for you. So there's kind of 4 basic steps. I've sat down with people and we've done a submission in 5 minutes. If you have the files right there ready to upload, it doesn't take very long at all. It's just probably more time finding files that are maybe years old that's going to be problematic. But basically, you're going to go in and you're going to set up the manuscript. You're going to tell it what article is this, and then what grants went into creating this article. So you're just giving it the background information. And then you'll actually upload the files, and pretty much at that point you're done and then you'll have to do those 2 approvals. I'm not going to go step by step through how to do a submission. It's fairly straightforward, and they have really good step-by-step tutorials on their website. So you'll see there's a tutorial for authors who are submitting this for themselves. There's tutorials on how to do those 2 approvals, and also if you're doing this work for someone, how to submit that way, and other things as well. This just shows kind of what they look like. They have big, bold instructions and I think are fairly clear. I do want to stop and take a moment to talk about logging in, because we're going to talk about logging in here and then logging in into My NCBI in a few minutes. So what they have tried to do is allow you to use accounts that you already have. So the way I like to think about this is, hopefully most of you have at some point tried to create an account in a new system and been asked if you want to use your Facebook account to do that. That's what they're doing. They're letting you use other accounts you already have to create your new account, so you won't have to remember a new login, which is nice. So for NIHMS, be submitted into the system, and down here it lets you choose the reviewer. So this is really important that you look at who's listed here and make sure that you have selected the person, whether it's yourself or if you're doing this for someone else, whoever you're working with, whatever author or PI, you can potentially go and kind of nag if they don't actually do the approval. So, you know, don't pick the person that's left in research and isn't going to care if this gets done. So just, you can pick whoever may already be listed because they're a PI of the grant, but you can also add in an author name and email. It has to be an author. So if you're like a grant manager doing this for someone else, you can't put your own name in. You have to put one of the authors of the article or a PI in this list. So take note of that so that you remember if something ends up sitting in the system, you know who you can contact and ask if they've gotten an email asking them to do the approvals. And then I just want to point out, remember I talked about that embargo period. This is your opportunity to tell them that this article has an embargo, that the publisher doesn't want it made publicly available for maybe 8 months. So you can tell the system that, and notice it says that it will release it to PubMed Central after that many months. So what that means is you'll get a PubMed Central ID number. It'll technically be in the system and you'll be in compliance, but they won't actually make that article publicly available and searchable and findable until after that embargo period ends. So it'll be hidden in PubMed Central, but it'll have an ID number in the system and you'll be in compliance. If you're ever unsure, go ahead and put in 12 months because you'll be falling under the policy, but you won't be upsetting publishers. And I will tell you that they typically check this before putting an article up into PubMed Central. They don't want to upset the publishers. So, okay, this kind of talks about, just again, don't forget those 2 approvals that need to happen. So the next part is to talk about My NCBI, but before I just want to make sure, are there questions about the manuscript submission system, anything that I've talked about so far? Yes?
What if you're not going to be able to find that final author document from 2009 because I'm published, I threw it away?
Yes, that's a good question. So the question is what if you can't find the documents to submit? I would start doing as much as you can to see if you can find it, you know, contacting other authors just to see maybe they have a copy. But we have found that several of the publishers that we've talked to, or our people we're working with have talked to, have been helpful with this. So if you really can't find it, contact the publisher and ask them if they would be willing to either give you a version of the document that they'd be okay with you submitting, or they may even submit it for you. The way that the publishers, like over time, publishers have changed how helpful they are about all this. Some of them have never done any submission at all. They haven't, you know, even submitted to the manuscript submission system. Some of them started out not doing it, but now they do, and those are the publishers that would be easy to get them to help you, more likely. So that would be our best suggestion. The final thing would be to like type it all up yourself, which wouldn't be very fun. Any other questions? Oh, yeah. Published. And then the second approval is, they do a lot of, in the web version, having links to a lot of things, and I mean they're completely changing that document into a different format, and they want to make sure there wasn't any incorrect changes made to that document. So they want one of the authors to look at it, review it, and just say, yes, you haven't made any changes that change the scientific integrity of that article, basically. Does that make sense? Okay, yeah.
Why are you talking more questions, I think?
That happens.
So frequently at the end, when you're getting a paper approved, the reviewers may request some changes, you submit another version, then may request a few more changes, submit another version. Eventually, they send you a proof. So is it the one right before you get the proof?
Yeah, it should be the one right before you get the proof that you would send. I've talked to people that I think have actually submitted the proof. I haven't actually heard back from them afterwards to see if that went through. So you could potentially try that and see if they'll accept that. I'm not 100% sure if they would consider that something that the publisher owns or not and reject it. If you do get it through, let us know. Yeah.
So if you put something in for somebody else and then you find out that something you did was not right, but like say the embargo time, and you want to go back and edit it, but it's already approved, is it possible to pull that back?
Certain things you may be able to change and other things not. And so it varies. And it might be that that person who has to do the approvals could change it. Like the first approval, they can change what grants were associated with it and things like that. But other things they couldn't change. So it may be that if you submit it for someone else, you may not be able to make the changes, but the person who does the approvals could. And some things, at some points, it just gets locked in, and the only way to undo it would be to contact the NIHMS staff. So it varies. Yeah, you're welcome. Okay, I'm going to forge on. Okay, now we're going to kind of talk about how to manage all of this for yourself. So right now, a lot of you are getting notices from us and from NIH, but hopefully going into the future, you can keep track of all of this yourself to make sure that you're in compliance and also that you're telling NIH that you're in compliance. So we're going to talk about using My NCBI to do this. Basically, I already mentioned that My NCBI and ERA Commons, those accounts need to be linked so that they share the information that's in each of them, and you can see that. So I actually just updated this because I was at NCBI all of last week for training on some other stuff that they have, and asked a whole bunch of questions about all of this, and they are trying to make this process easier. But at the moment, what you will do is go to any NCBI webpage. That could be PubMed. PubMed Central is also a product of NCBI. You can just Google NCBI and end up on one of their pages. Wherever you are on their website, you will see a link up in the top right hand of the page, and it says sign in to NCBI. And so you'll click there, and I just changed this so some of the slides you have is a little bit different because they just updated this to make these stand out more, I guess. But if you've never been into the system before and you're starting this so that you can manage your compliance, you should just come in and click on the button that says sign in with NIH account. Probably a little difficult to see, but when you're logged into an account up in the top, you'll see your username. And when you click on that, it takes you to your settings. I don't know if you can see from in the back, but you'll see here that this account, I have two linked accounts, my Duke and my Google account. So I've gone in and I said, both of these accounts, I want to be able to log in either of those ways to get into this same account. So if at some point you have logged in one way, and then another way, you can go back in later and then make those all one. So this is important for anybody who's been using My NCBI prior to all of this happening, because they may have been coming in and maybe they started this a long time ago and have a username and password. They have stuff saved in there. They don't want to lose it. Well, now they need to use that old account and link it to their NIH ERA Commons account. So what you do is log in the way you've been logging in. Go to your username to get to your settings, and then click change next to the linked account section here. And you'll be able to find in the page that opens a link to add the NIH ERA Commons account as one of the linked accounts. So try this process. I will tell you that this doesn't always work. They have a known glitch, which again, like I said, I asked a lot of questions last week and they're trying to fix this and make it easier. But for now, if you do this and you get an error and it's not linked, you can email them directly, and they're usually pretty quick about responding. And you just give them your username for My NCBI and also your username from ERA Commons and email. No passwords, just the usernames, and they'll manually link those accounts for you. if you have correctly logged and linked your accounts, you will know, because when you open your bibliography in My NCBI, you'll see an ERA little logo icon here at the top. So this is what you want to look for once you think that you've linked your accounts. Then go in, open up your bibliography, and see if that's there. If you're acting as a delegate, which I'll talk about more, so you're doing this work for somebody else, you'll want to go into that person's My Bibliography and see if they have that ERA Commons link there. So that's what you want to look for. Now, once you've done that, if you haven't already, yeah.
Hi. As a delegate, when you say go into their account, do you mean use their password to go into their account?
No, so I'm going to show you at the end how to, so in my bibliography, a person can set up delegates. They just put that person's email into the system, and then that person can basically log in and do everything in that person's bibliography. But it's a separate sort of piece. So if you're a delegate, you'll have your own way of logging into My NCBI and have your own bibliography, which if you're a delegate and you don't have your own NIH funding, you probably won't ever put anything into your own bibliography. What you'll be doing is putting stuff into those people's bibliography, and I'll show you where those are near the end. Does that make sense?
I've done some of that. I've got two people that I'm a delegate for.
Yeah.
Right, we work together on
Yeah.
this. But it seems like I have limited ability to really do much other than update their bibliographies.
You shouldn't, but see if you still have this question at the end. Or we may need to talk individually too. Okay, so once you've set it up, if you haven't already, you're going to need to put all of your publications into the bibliography. And our recommendation is to put everything that's coming out of any grants you're PI of, anything you're publishing, even if it maybe wasn't NIH funded, because this is the place where you tell NIH that it's exempt, or this is the place where you tell an NIH that it's already been submitted somewhere, or so on and so forth. So what you should do is in your bibliography, click Add Citation. The box that comes up, the first option is to go find a citation in PubMed. Start by doing that. See if you can find the article in PubMed. It's much better and much easier if you use the correct bibliographic information that's in PubMed to do this process. However, there will potentially be times where you need to create a manual citation, type the information in yourself. For instance, if it's very recently, like it was just accepted for publication and you want to go ahead and get this process started, it won't be in PubMed yet because it was just accepted and hasn't been published. So in that instance, you might need to do a manual citation. If you do manual citations and you submit it to PubMed Central, everything that's in PubMed Central will actually be put into PubMed if it wasn't already in there. So eventually, you'll end up coming into the system and it'll give you a message saying, I think we have a record in PubMed. Do you want to change that from the manual to the PubMed record? And it'll override that. So you can click Citation PubMed and then say you want to go there. You can search PubMed however you want. I like to point out the single citation matcher that's on the home page. So when you click on that, this is kind of a nice way to do an automated author search. So as I start typing in an author name, it actually brings up things that are in the system. So these are actual, it should bring up a good list of articles based on that author name. You could also do it by article, just put in the journal name and maybe the publication year and a page number or something to bring up specific articles. You don't have to fill out the whole entire form, just a couple of things. So when you find things, so this is a specific article, but if you had a list of results, maybe you did an author search and just wanted to put everything on that page or certain ones, you can check boxes next to everything, and you'll see a send to box here. And when you click on that, you can say you want to send it to the My Bibliography and add it. And I'm specifically showing what this will look like for a delegate. If you're doing this work for yourself, you're in your own account, you'll actually want to just put it into My Bibliography. So as an author, PI, you're doing this, that's where you'll put it. if you're doing this for someone else, you're someone's delegate, you'll actually have the option to put it in other bibliographies you manage, and you would just select the radio button and then choose the correct person. Okay. So again, you want to look at, and so this is what it'll look like if you're working on someone else's, you're a delegate. Notice it has the person's username and then says you're in their bibliography, whereas if you're in your own, it says just my bibliography. Again, in someone else's bibliography, you want to check the ERA logo. Now this might answer your question. So sometimes people will look over here and not see the little red and green, the icons. The reason is they need to go to the display settings here. So click on that, and then this brings up this box where you can tell it you want to see the award view. If you haven't done that, you won't see those icons, but once you click award and apply, now you see red and green and yellow, and these are all the potential indicators you can see. So red, of course, is bad, and it tells you why it's not. So here it says it's not in the NIHMS. It hasn't been put in the manuscript submission system, and it hasn't been put into PubMed Central. Sometimes you'll see that it has been in, it has an NIHMS ID number, so someone has submitted it to the manuscript submission system, but it's taken too long, it's sitting in the system, hasn't got the approvals, and so it's red because it's out of compliance for being out there for too long. The yellow is typically those method A or B journals, so the ones that the publisher is doing the submission. Green, you're good, it's in PubMed Central, it'll show the ID number there for you. NA, that's not applicable. Remember I said this is why you want to use this system. This is your opportunity to tell NIH why an article doesn't have to be put into PubMed Central. So these are the articles that were accepted for publication before April 7th of 2008, or they weren't peer-reviewed articles, or they weren't NIH funded. Question mark, that just means the system doesn't have enough information to figure out where it goes above. The ones you're going to be concerned about are anything in red or with a question mark, so you can click Edit Status or whatever this link says, the citation not in there. And when you click on that, it opens this box up, where you can say that it wasn't NIH funded by just clicking Edit and saying no. If you haven't already associated it with an award, a particular grant, you can edit that and do that. I'll show you that in a minute. And a lot of times that's the reason that something would come up as a question mark is because it hasn't been associated with a grant yet, so they're not sure what to do about it. Down here is where you can actually say this needs to go into the manuscript submission system. I'm going to click here and start that process. It'll actually open up a new window and you can start uploading files. If you've already done that and are now coming back into the bibliography, you can actually, you'll have an ID number from that system that you can type in and tell it that you've done that. And that usually only happens if when you submitted, for some reason you didn't associate it with the correct article, or you didn't associate it with any article when you were uploading the documents into the manuscript submission system. Otherwise, it usually keeps track of that, yeah.
Quick question. How do you find out who initially submitted a manuscript if it's been sitting in the submission system for a while? You didn't do it, your PI didn't do it,
Yeah.
or someone else involved did it and it's been sitting there. How do you find out who actually submitted it and hasn't approved it yet?
That's a great question. So the question is, how do you figure out who submitted something to the manuscript submission system? It's not actually figuring out who submitted it that's important, it's who's supposed to do the reviews that's important. Because a lot of times it's the publisher that submitted it, and it's like you don't know who of the authors or if it was one of the PIs that they selected to do those approvals. If it's an article that's out of compliance that NIH has found, we actually, and it's something that we're emailing you about, that name will be listed in the files, like we can sometimes get you that information basically. So you can ask us. The other thing would be to, I'm going to talk at the very end, show you how to what's called claim submission. So any author or PI on an article should be able to go into the manuscript submission system, and if something has been submitted and it's sitting there and nobody's taken responsibility of it, they can ask to have that responsibility. So I'll talk about that more kind of at the end. And the last thing would be to actually contact the staff at NIHMS and ask them who's supposed to be doing this? Can you send them an email or let us know, or whatever they prefer to do? Because that's one of the things that's very hard to figure out, unfortunately. Okay, so if you've paid a publisher to do this, you can tell them that here. And then finally, here's where you tell it why this article is exempt. Not peer-reviewed, accepted before that date. This one I don't usually mention, but if it was published in Russian or Japanese or something else, that's also exempt. Although we did find out that if it was translated into English, then it's not exempt anymore. Because there are some journals that automatically translate them and publish them in an English version as well. And then if it was not supported. So again, it's really important. NIH right now is pulling data from a lot of different places to try to flag as many articles as they can. So a lot of the things that they're flagging may not actually fall under the policy. The only way to let NIH know that, or the easiest way to let NIH know that, is to just put it in your bibliography, click edit status, and then select one of these things, whichever one is correct. This is that awards tab. So remember I said that your grant information from ERA Commons will show up in my bibliography if you have correctly linked your accounts. So for each article you can associate particular awards, and this is what it kind of looks like when you go to do that. You'll see a section called My Awards. Those are things that are actually in your ERA Commons account that you're a PI of. Other awards are things that have been associated with articles that are in your bibliography that you're not a PI of, but you must have worked with someone, or you must have gotten funding for that article. Things don't always show up in those two lists, so you can also search for other awards to add using this tab. Okay, and so in my bibliography, a PI or an author can ask someone to do this work for them, and to do that, they'll want to create a delegate, and they'll go into their bibliography, edit the settings, and then say add a delegate on that page, and just put the person's email address in. The person will get an email, and if they haven't already, they'll want to create a My NCBI account. In the email that they get, they'll have a URL they click on, and it'll step them through the process of then confirming that connection. Once somebody has been created as a delegate, they should be able to do everything that that other person can do in their bibliography. I've had a lot of people ask, does being a delegate in ERA Commons mean you're a delegate in My NCBI? It doesn't. If you're a delegate in ERA Commons, you still have to go in and go through these steps to make somebody a delegate in My NCBI. And this is what it'll look like. So if you're a delegate for someone, you'll actually log into your My NCBI, and under the collection section, you'll see all those bibliographies listed. Okay, the final piece is that you need to demonstrate your compliance. So if you're doing a biosketch, progress report, anything like that, you need to show that the articles you're citing are compliant. Everything that's come out of your grants are compliant. So you technically have three options: the PubMed Central ID number, the manuscript submission ID number, or if it's one of those yellow ones, you can say that it's in process. A PubMed ID number means nothing when it comes to the public access policy. If you want to put that in there, it's just extra information, but they will send it back to you and say, no, please give me one of these other ones if that's all you put in there. So make sure you have one of those three. And then beyond that, there's actually a timeline. So the only one that you can always use is the PubMed Central ID number, but the NIH ID number and that in process, they expire after 3 months after publication. So basically, they assume that it should take 3 months to get something submitted, whether the publisher's doing it or you're doing it through the manuscript submission system. So if 3 months after publication, that hasn't made it to the point where it's now in PubMed Central and has an ID number there, you're actually out of compliance. Everybody kind of at this point is like, wait, what about embargoes? So remember I mentioned that when you submit to PubMed Central, if there's an embargo, you can tell it what that is. It'll be put in the system, have an ID number in PubMed Central, but it won't actually be released and made publicly available until the end of that embargo. Okay, I like to just mention this. There is this sort of historical. Now you can do this using my bibliography, but if you had a couple of PubMed IDs and you just wanted to quickly see if they had PubMed Central or NIH IDs, you could just list them in here and convert them. It's not really necessary anymore now that you can do that in My Bibliography. Just a quick update. So the library has access to the reports that NIH is submitting, and we have at this point emailed all of the PIs that currently we know have any article out of compliance. So if you haven't gotten an email from us, you are hopefully okay, at least for now. They are constantly adding stuff to the list, so it varies, and it also it means that you should try to make sure that everything is in there and in compliance now, and that you're working on figuring out how to use My Bibliography to manage this into the future. I think we're kind of on hold with training sessions at the moment because we've done a lot, and so we're going to wait and see how much more people want. So, but if we do more training, they would be at this link. And really quickly, I just want to open up the guide. So this is that guide that I mentioned. It has pretty much everything we talked about. These are the slides that I used. And you can kind of go through everything. I've actually just put the tutorials from the manuscript submission system in here, so you can actually get to them and go through them from these pages. I just figured it's easier to just come here and find them than to try to find the correct link to go to, so they are there. This is also, I mentioned I would point this out, these are the instructions for how to claim something that's in the manuscript submission system that's been sitting there and you don't know who's supposed to do the approvals, or you can't get in contact with whoever's supposed to do the approvals. You can just come and read these instructions. It should be pretty easy. Okay, it looks like there's a few minutes left. You guys had questions during, so it was, what can I answer now? Yeah?
Does Duke's, I think it's called Faculty Central, tie into this bibliography?
Not that I know of. And some of that stuff is changing. If what you're talking about is what I think you're talking about, I think the provost is potentially moving to new systems for some of that, and I've been pushing them to pull all of this in somehow.
I
You're talking about
something.
Fred, and
Yeah.
that is being retired, and this is supposed to be linked to it.
Yes.
The new
I
version.
tried to look at mine, and it looked like it was referring to this, so I don't know what I was looking at.
It may, well, I don't know about that. So Fred is being replaced by a new system that should be rolling out on the medical side anytime now. I've been working with those people on trying to work in if people go and work on their bibliography, can we get that out of there into that system much more easily? But all these systems, what they're trying to do is use data that has somehow been read over and made sure that it's correct, because in Fred and a lot of bio sketches, people were typing all of this in by hand and trying to remember things, and there was a lot of errors. And so that's why a lot of these, that's why they're making people use PubMed and My Bibliography right now, so that the data that people are submitting is correct.
But for NIH BioSketch, you have to select, because you can't put all of yours, so how does that
You can do that in My Bibliography. You can select certain ones and generate a PDF from there, and then it's going to be different when you do like RPPR reporting. It's all your publications will show up in ERA Commons, and then you can pick and choose which ones you want to put. So in My Bibliography, if you wanted to create a PDF, you can actually select certain ones and then generate that PDF from there. And it should put it.
BioSketch, you can also.
Yeah, yeah. So you could do that to create anything.
The hold that NIH is putting on is just for the PI's manuscripts, or is it for anybody with a BioSketch under the PI's grant?
So yes, we've had this question before, and our suggestion would be to focus on the PIs, but I would try to get everybody involved. If you're submitting or continuation, I would try to make sure everybody is as compliant as they can get at this point in time. Definitely focus on making sure everything that's a result of that grant is in compliance, and then start worrying about each of the PIs and other staff that are listed.
Okay, well, if there are no other questions, I'd like to thank Emily for some very important information.
Thank you.